This is an Eye on Annapolis bonus podcast.
Well, I'll tell you what, I've been here a few times before. The first time was because things changed with the health connection under former President Trump, and then the extensions for open enrollment through COVID, which was huge. And now, just because I got an email saying it's open enrollment time, I thought it was time to talk to Michele Eberle, who is the executive director of the Maryland Health Benefit Exchange. How are you doing?
I am good, John. How are you today?
I'm good. I'm enjoying this somewhat spring-like weather that we're having. I'm waiting anxiously for winter. I hope we get dumped on with a bunch of snow eventually, but I may be in the minority, but we'll see how it goes.
And you better have health insurance in case you slip and fall.
I'm really very cautious when I go out and do that. I do try to go walk every day. And sometimes the roads and the sidewalks are a little bit dicey. And what I'll do is I'll go up to the Giant, which is up the road from me, because they do a good job of plowing their parking lot. And then I'll just do like back and forth in the parking lot. I look like a nutcase, but it's, but no, I did get an email saying that it is open enrollment time. And that started on November 1st for Maryland Health Connection. And we wanted to talk, and for those that are unfamiliar or just need a recap, this is the Affordable Care Act, more commonly known as Obamacare, right?
That is true.
Okay, and it is health insurance available to those who are not getting it through employment or on their own.
Yes, correct.
Look at this, man. I'm batting 100, batting 1,000 right now.
You are.
Okay, so this product, I mean, this is the health exchange where you can go in and you can shop for health plans if you aren't able to get it through work or for whatever reason. And I mean, I'm a member. Are we members? What are we? Users,
well,
members?
we call you consumers.
Okay, well, I am a consumer of MarylandHealthConnection.gov.
Excellent.
And I imagine this is also perfect for the or underemployed sole ownership people like myself.
Absolutely. And in fact, it's even more important now because through the one of the recent changes in federal rules, there now is a potential for tax credits for folks that have a higher income level. So that wasn't the case before, but that was a change that came in through the American Rescue Plan Act. So that's a good thing.
There's too many acts and plans that are going on here to keep track of. I don't quite understand that. But, and the program is not free by design, but it can be depending on your particular situation.
Yes. So you are absolutely correct. So the exchange is the state's designated health insurance marketplace. And as you said, it is for people that have to purchase insurance for themselves, whether their employer doesn't offer health coverage or they're self-employed, or maybe their employer only provides it for the employee and not the family. So those are all different reasons why you would come to the exchange. And each year between November 1st and January 15th is the open enrollment period. What's important to note about that is that for January 1st coverage, you need to enroll by December 31st. So if you come in through that January 1st to 15th period, your coverage date would be February 1st. So that's just a little nuance. But we've worked as a state over the last several years to really make the insurance premiums very affordable for Marylanders. And in fact, last year we had two of the lowest plans in the nation in terms of monthly cost. But in addition to that premium cost, it's really important to know what you anticipate your medical needs to be and what we call out-of-pocket costs might be. So we've done a lot of work through our in-person consumer assistance workers, through our mobile app and through our website to really help guide consumers purchasing health plans to find the best plan for them. Oftentimes people will say, well, here's one with a deductible. That deductible is the lowest deductible, so that's the one I'm going to get. But depending on your income level, you may be better off in a different plan that has a little more coverage for you. And that might cover, say, your deductible costs, things such as that. So we really encourage people to come in every year, take a look, go through the system, call our call center number or go to one of our sisters to just reevaluate. Is the plan that you have still the right plan for you?
Well, I will say that any insurance, it doesn't matter whether it's homeowners, car, executive umbrella, whatever it may be, health insurance, it's always so complicated. It really is. And I will say that when I did sign up through the MarylandHealthConnection.gov last year, it was fairly simple. I did have a couple questions. I did call in to say, and perfect, reasonable amount of time on hold and a perfect answer when I finally got through to somebody. But it is a very confusing thing, and I do recommend everybody. You've got great advice there that make sure you're getting the plan that is right for you, because something that's working for me as an older single guy is not going to work for the young married couple or the family or anything like that. Not depending on what you're able to afford on the deductibles and everything else is there. What has changed in the program, I guess, for this year, if anything?
So we have a couple changes this year. One is actually continuation. So last year we started a new program called the Young Adult Subsidy, and that is anyone between the age of 18 and 35. There's an additional financial assistance that the state is offering. And so on top of any federal tax credits someone would be eligible for, there's also this Young Adult Subsidy program. So there's actually, in fact, I'll just I don't have Anne Arundel County here, but say you're 28 years old in the city of Baltimore and you purchase our Gold plan, which is one of our richer benefit plans, that will only cost you $17 a month. And that's because of what the federal tax credit would be. And then on top of that would be the state additional credit for that plan. So that's something that, again, we all benefit when we have young, healthy people in the plan to offset, higher utilizers. So that's what's called the whole risk pool. But we really want young people to understand that, you think I'm young, I'm healthy, I don't need it. But going back to that walking in the parking lot or walking when all the snow comes, you don't know if you're going to fall and if you're going to break a leg, and then that's going to be costly. Or, we're seeing cancers in younger people, so you don't know if that would happen. So we just want people to know the benefit of having health insurance to protect you, but then also the value of that health insurance. And that comes in play now with the preventive services. You can get your immunizations free of charge. You can get your cancer screens like mammograms, colonoscopies. Those are free of charge. Of course, you pay your premium, but there's no deductible or copay on those. So it's really important to come in and get yourself covered for your peace of mind. And if you have a family, for the peace of mind of your family. Well,
you're absolutely right, because you never know. I was at a meeting this morning over at Annapolis High School, and there was a girl there that was doing some interning, a student, and she was carrying a pitcher that had hot water or something in it, but the bottom of it just broke away. So I guess the hot and the cold or something like that. The glass came down. It was heavy enough. It cut her foot, cut through a tendon, and broke bones. And there's somebody that's 17 years old, and had no idea that this was coming. It was just a really sort of a freak accident, and she's having surgery in the next couple of days to get it fixed. So you do never know. And also that 18 to the 35 crowd they're the idiots that are skydiving and doing doing stuff like that. I've outgrown that, although I do think that 18 to 35 is kind of a little bit of an ageist thing. I'm going to be talking to my lawyer about a class action suit here. I mean, I can get in on that $17 a month premium.
Well, I'm telling you, there's good premium prices for all age groups. So we're pretty proud of that. The other new thing is, you asked about what's new this year. Another change at the federal level is that families that, or let's say if I got my insurance through my employer, and it was my employer contributed to my insurance, it was affordable, it was fine, but they don't contribute for my spouse and my dependents. So it's really too expensive for our family to afford. In the past, the family members would not be eligible for a tax credit because it was considered affordable insurance for the employee. They've now changed that rule so that when they look at the affordability, the plan for the whole family has to be affordable. And this is it's, again, talk about complications. The point is, if you are insured through your employer and you're insured for yourself, but you either don't have insurance for your spouse and your children, or it's unaffordable for you, come to MarylandHealthConnection.gov and check it out, because you may be eligible now for tax credits that you were never previously eligible for, and you may be able to get low-cost health insurance, quality health insurance.
Oh, wow. That's something good to know.
Mm-hmm.
That's something good to know. Well, another question that actually I have, and this is purely self-serving, but if we enrolled last year, do we need to complete a re-enrollment every year?
Great question. If you are happy with your coverage and everything, is the same, and you just want to keep it, it will roll over. You don't have to do a thing. We send out notices in October to tell you, here's the plan you're in, here's what the new premium's going to be, any changes. And if you're perfectly happy with it, you don't need to do a thing. It will just we call it auto renewing. So we'll re-up you for the following year.
And I assume that you grab that same information off of the Social Security number when you did it through the IRS and stuff like that. So if all of a sudden I'm pulling in that $10 million a year, my rate will be going up a little bit.
That's right. We look at all of that.
Awesome. Well, I'll tell you the deadlines that we need to know. Right now we are in open enrollment. It's January 15th is the deadline to enroll.
Yes, for February 1st coverage, but December 31st, you want to enroll by December 31st for January 1st coverage.
Okay. Now, what happens if somebody, let's just say that on January 16th, I get canned and I don't have a job. Mm-hmm. Money is tight. I can't afford the COBRA payments from my employer because they had a really good health plan or something like that. Do I just have to hang out until next November?
You don't. There are certain situations where you could get enrolled. So if you had, in that case where you had coverage through your employer, say, and then you don't have it, that's referred to as a loss of minimum essential coverage, and you can come in. There's a special enrollment period. Likewise, if you get married or divorced and you need to change it, or you have a new child, or you adopt a child, those are all what we call life events or special events, and it opens a period where you can get insurance. If you're 26 and you're aging off your parents' health plan. So all of those are different opportunities. And in fact, the other new thing this year is that we now have a special enrollment period year round for folks who are in the lower income bracket. So if you're an individual and your income, your annualized income is less than about $20,400, or say a family of four, it's about $41,500. If your income's less than that, we're allowing a special enrollment year round. So that's something new this year as well.
Well, that's probably makes a lot of sense to me, just because when you have typically low income homes, you're focused on the home and maintaining the home and stuff like that, and not necessarily your health. Mm-hmm. I'm healthy. I can, I'm okay. You just never know. So that makes a lot of sense to me, to be able to go into the lower income homes and be able to say, hey, this is something you can afford, or maybe just, perhaps get it at no cost, right?
Mm-hmm. That's correct.
All right. Well, we also probably need to mention, this is not the MarylandHealthConnection.gov, and the Maryland Health Benefit Exchange is not for the over 65 crowd, right?
That's correct. That's Medicare, and that's a federal program. But the Maryland Department of Aging has a group called, we refer to it as SHIP. It's a senior health insurance program. And they're terrific at helping anyone over age of 65 navigate the Medicare system.
I hear that's a nightmare. I'm not there yet, but I hear it's a nightmare. I've talked to so many people. They're like, I'm just ready to poke my eyes out.
It's complicated as well. There is another, let me mention though, there is another Medicaid, which is for individuals on the lower income spectrum, and that is free health insurance. That is available year round. And so that's even below those dollar limits I gave you before. So that's really where, we just recognize that you can't afford health insurance if you are at that low income level. So that's Medicare. And those do come through the health exchange. We can enroll you in that, but it's open year round. So there's not a sense of urgency like with the open enrollment period for private insurance.
Okay, so this was for and I think the things you had told me were like $20,000 for an individual and like 40 some odd thousand for a family of four. So the Medicaid would be for the folks that are earning
even
less
below that,
less
than that. Yeah.
And then that program for those lower income, that is an additional subsidy that would reduce or possibly eliminate the premium?
Yes, correct. So when you're on Medicaid, the federal government picks up about 75% of the cost, and the state picks up 25%. So the Medicaid level for a single person is about $18,700. So if you're an individual making less than that, you'd be eligible for free insurance. You may be eligible. There's some other little requirements, but you may be eligible.
Interesting. All right. Well, if anybody does not have health insurance, and actually, to be honest with you, I think that depending on your situation, it's probably worth a look, even if you do have, because it might make sense to shift over to it if you're paying some crazy premium through an employer for a family. This may be, depending on your situation, this may be more cost effective for you. Is that somewhat accurate?
It is somewhat accurate. There are some formulas that, has to be deemed unaffordable, but anyhow, we can help figure that out. And, it doesn't take a lot of time or effort to just come in and check it out. We have where you can put in just your county, your age, whether the coverage is for health or dental, and if it's for just you or your family, and those little bits of information. And then we, just by putting the information in, we could tell you what your income, what you'd be eligible for tax credits, for young adult subsidies, and then you could actually see the different types of plans that are available. So it's all built into the system, and we have tried to make it as easy as possible for a complicated matter.
Well, for the simple matter, too, you've made it very easy. I mean, you can go online to marylandhealthconnection.gov, and there's nothing funky about the spelling on that. They do have folks there that you can call and actually talk to a human. You've got a little chat assistant. Her name is Flora, and I think she's a fake person.
Yes.
Who can answer I'll say the stupid questions. I always grew up and they said there's no such thing as a stupid question, but I'm going to guess that the automated attendant answers the common question. She's like the fact woman, I guess.
Well, we have Flora, but you can also go to a live person through Flora. So Flora uses our artificial intelligence, and we've got lots of common questions that it will respond to your question. But you can also say, I want to go to, live chat, we call it. So I want to speak to somebody live, and we'll connect you up to somebody that's live. We also have, I keep forgetting all these new things this year. We have a new program called Broker Connect. And if you're online or on your mobile app, and you want to be connected with a authorized licensed producer, that this is their business, this is what they do, you can, within 30 minutes, they would call you back. So what we do is, you say, I want to talk to somebody. We send your information out to a list of several brokers in the area. And then they have 15 minutes. So they have to respond to say, yes, I'll connect with this person. So if they don't respond, then we re-up to other people. But anyhow, the idea is that within 30 minutes, you can be connected to a licensed authorized producer who are experts in the insurance industry.
That Broker Connect sounds sort of like going on Facebook and saying, hey, does anybody know a good realtor? Boom, 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 boom. You get hit with it all. Or
Well, but this is private. Just,
right. Right.
Just one person.
True. And you do have an app too, and I'm drawing a blank on the name of that. So, I mean, you do make it real easy. I mean, you can do this walking down the street. You can do it sitting at your desk at a red light because you're not supposed to text and drive. So do it at a red light or when you're parked.
Enroll MHC.
Enroll MHC. Simple enough. Simple enough there. And again, there's a number on there. Now, question for you, is everything that you guys do, is that all local? I mean, do you guys have, when I call in, am I talking to somebody in Maryland?
Most often we have, all of our staff, the exchange staff are local, obviously. For our call center, we require 51% of the call center reps to be physically in Maryland. We do allow outside of Maryland because that helps us, especially if we have a bad snowstorm or anything like that, where we can still keep operations going.
You hiring for somebody to maybe go to Hawaii and answer the phones for you?
No, I think there's another. I think the other facility used to be in Colorado. They may have to change it now.
Well, that makes sense too. Also, it also helps with the time difference and I imagine your call volumes that come in there. I did notice on your website it says that the application is available daily from 5 a.m. to 1 a.m. What happens between 1 a.m.
and 1 a.m. and 5. So between 1 a.m. and 5 a.m., we use those 4 hours to make any updates that we need to make to the system. If there's any, anything we need to do, we just preserve that time for us to be able to do any updates we need.
Okay. So how often are you there plugging away at a computer between 1 a.m. and 5 a.m.?
I personally am not, but I will tell you that my staff, the night before open enrollment, we had staff up all night getting prepped. And of course, we always have at 5 a.m., we have people in the office just kind of celebrating the open enrollment. It's a little bit less now with a more remote work, but it's always a fun morning.
True. And I will say also that one final thing as we start to wrap up, that you can go to marylandhealthconnection.gov, and if you have an account, you can log in and you can make all your changes. You can create an account and everything else, but you can also get an estimate, which gives you, it's exactly that. It's an estimate. It tells you about what it's going to cost you. And you can see where to see if it is affordable for you. And I'd be willing to bet that it is, because I know when I first did it, I was like, oh gosh, am I really going to be able to swing this? And I was pleasantly surprised.
Excellent. That's what we like to hear.
Do you have any idea how many people in Maryland? I'm going to guess that number's off the tip of your tongue, but how many people in Maryland are participating in the Maryland Health Connection?
Yes, we have. Last year at our open enrollment, which is always a peak because as the year goes on, people will get off in their enrollment. They might get employed, but we had over 180,000. And when we sent out our renewal notices, I think we're at 163,000 right now before the open enrollment. So that's just some private commercial plans. Excuse me. Then we have about 1.2 million people in Medicaid. And then we also have about 50,000 that get dental insurance through us.
Okay. Interesting. Do you have any idea of how many in Anne Arundel County? I'll put you on the spot.
That I don't know.
No.
I have that information, but I don't know at the top of my head.
That's fine. Well, I'll tell you what, folks, if you need health insurance, you want to go to marylandhealthconnection.gov. Michele Eberle is the executive director, and she's cracking the whip among all these folks here to make sure that it works smoothly. And, it's always a pleasure to get caught up and figure out what's new, because it is such a complex issue, at least for me. Maybe I'm just dense when it comes to some of these things, but it's been I can't say a literal, but I mean, it's been a lifesaver for me, and it certainly gives me peace of mind knowing that I am covered in the case of something, goes wrong, and that, bus does hit me as I'm crossing the street or something like that. You're not going to get me skydiving. That's for the young kids, though.
Well, maybe the new boat in Annapolis that pulls the
the parasailer.
Yes, the parasailing.
Yeah, I did that once down in I think it was in Cancun or something like that. I haven't had the chance to do it over the Chesapeake Bay. It always seems a little bit nicer to do it over crystal clear blue water,
warm water,
as opposed to the murky brown water of the Chesapeake Bay. But I imagine the views are spectacular when you get up there. Mm-hmm. Michele, thank you so much for your time today. Thank you guys and your entire team for all the work that you do. I imagine come November 1st, this is sort of like when the IRS loads in their new tax rules every year for accountants, and you just got to, oh my gosh, it's crunch time. You breathe a little bit, and then, you sort of wrap it up in January. Again, the dates you want to know, January 15th is the drop dead date to apply. Your coverage will begin on February 1st for that. If you want a January 1st coverage, you need to get that in by December 31st. And don't do that, because that's going to ruin everybody's New Year's Eve, right?
We'll handle it. We'll take care of you.
Fantastic. Michele, thank you so much for your time today.
And thank you, John, for giving us the opportunity. We really like to get the word out and appreciate you giving us this time.
This has been a bonus podcast from Ion Annapolis. Please visit us at ionannapolis.net. Follow us on Facebook at All Annapolis and on Twitter at Ion Annapolis. And if you haven't subscribed to the Daily News Brief podcast, go for it. And all of your local news will be delivered to your phone, tablet, or smart device by 6 a.m. every Monday through Friday.